live today. For the audience, please don't hesitate to throw your questions in there and we'll get them answered for you today. Hopefully some of you heard your female fertility talk.
If there's any questions on it, Jim, they have more, they can throw that in as well.
That's true. If you missed something along the way, then feel free to.
This is their time. I want to answer any questions possible.
And because of that, I've extended the time today to 30 minutes as opposed to 15. But if we finish up before the clock strikes 0, so be it.
So be it.
So great stuff.
Well, you're known for being relaxed and not strict. I know that, so we're okay on that.
Yeah, I know. I'm not anal at all. So obviously we covered female before, and certainly we can go back to that based on what the audience wants. But to start the last talk, we talked about the declining fertility rates in the country, and you talked about certain percentages per week that the average female would get pregnant,
20%.
that they've dropped
Per month.
and obviously from an age perspective, they're going to change anyhow.
Yes.
From a male perspective,
Ready to blow your mind?
Go ahead. I'll let you go. Are you ready to go?
Crazy. It's interesting. From 1970 to today, we've decreased sperm count. Well, from 1970 to 2002, in North America, we've decreased sperm count 1% per year. It's like a lot, but it's 1% per year. Add it up.
So 1970.
1970 to 2002, so 42 years.
So could one argue now it's dropped what?
Well, you wait, from 2002 to
54%?
It's actually, from 2002 to today, it's down at 2% per year. So it's plummeting. There was a paper done probably 7-8 years ago, looked at Western Europe, North America, New Zealand, Australia, and they found today's man under 35 is 50% our generation, 50%. These numbers at Hebrew University did a study, they expect with MIT, they think by 2050, those same population base being infertile, 0. Right now, 3 to 10% of American young men under 35 have 0 sperm.
So what's the measurement? Because I read somewhere where in the old days, the average male had 30 million per.
About 100.
Okay, and now
They consider 20 low.
We're at 15 at this point in time.
But I consider low was basically 0 was 20 million.
Okay,
and now it's actually lower than that. Now they're seeing 10 million, but the numbers keep going down and down and down. With IVF, all you need is 1 sperm to get in and penetrate. They do that with this little pipette. But that all being said, where's the outrage? The problem is a lot of people in the world think we're overpopulated, so they're happy with it. There's a book done by Larry Burkett in 1992, 93. And they were talking about how the population at the time was about 6 billion people and made it seem like a lot. So how big is that? If every person stood side by side, they could fit in Jacksonville, Florida. That's not, that leaves the rest of the world for everybody else.
Right.
There's no, I forget the actual number, but I think every person would have like 4 acres in Texas.
Right.
So we're not close to it. And in a free market, look what they've done in California. Trump talked about this in Rogan. They've turned off the water supply. In California, where I'm from, there was a lake. The whole San Joaquin Valley was a lake to the 1860s. They now divert all that water that goes down the Sierras and down the Sierras into the lake, diverts to the ocean. It's like what that they want to make the population. What are they doing? Okay, and this is very frustrating because there are answers. Like we're fighting this battle, but the battle is we don't have an answer because they're manipulating the system. So that's a little frustrating. Like if California had all the water it's want, when Reagan was president, California became considered the 7th largest country in the world by GDP. These are things we're doing to ourselves because of this idea of overpopulation, and that cannot occur. So we have to understand the science in the sense of what population is, how it grows. So it's very frustrating though when you have young couples wanting babies and they have no sperm. Again, I love adoption. I've done it. My wife and I have been blessed to do that ourselves, but let's look at the cause. We never look at the cause. You look at the result and try to find a band-aid for the result. I always want to look at the cause. And if we can look at the cause, I think Robert's going to bring a lot of answers to those kind of causes. And I don't believe somebody's going to hurt us on purpose. They want to make food cheap and abundant, but sometimes not going to be healthy. Will there be ways to do it, be abundant, but not be a food you can't pronounce what's in it?
Right. And they also want to preserve it.
Yes.
So we have plastics that have proliferated in society.
The biggest one, Jim, is atrazine. Atrazine is a chemical. There's a pond in England where it spills as atrazine spills into it. There are now no more male frogs. They actually convert them all to female frogs, or having male
so
frogs.
Why don't you tell us what atrazine is?
It's a pesticide. So they're spraying on everything.
And it's in the water supply.
It's in its water supply.
Okay.
And it's just, I mean, look at atrazine. Make your head, go, how's that even out there anymore? And again, I'm not saying from moment one they should know this, okay? That's not the goal. Because I want big pharma, I want industry to think and new chemicals and change. I want that. They got to be able to compete on a level playing field. That's the important part. They cannot make rules and enrich themselves, right? They have to be able to compete in a free market. And but the most important free market is the person, us, have the choice to choose what we want. And it cannot be forced. I mean, just look at a bag of Doritos in America versus England. Look at a oatmeal versus here in England. Why are we have different food? And therefore, you look at our sperm count, something's going to be happening.
Sure. All right, let's go to some questions. We got a female question first. How do hormone levels change as women age? Should I be concerned about getting pregnant in my 30s?
Oh, no, not at all. Menopause is a natural thing. There's a book, there's a paper called the Menopausal Society has this paper came out. They're talking about medical hormone treatment. And in this article, this came out about a week or so ago, they don't want to treat the benefits. Like you can't give it for cardiovascular prevention. You can't give it for dementia purposes, just for vasovagal response, just for hot flashes. You're like, wow. What about all the science? And stop at the age of 60, which is crazy stuff. But all that being said, for fertility reasons, a healthy person, if they're ovulating, yes, eggs do age over time. This is very interesting. A female baby in the womb at 20 weeks has about 20 million eggs. Very active baby growing. At birth, it's about 7 million eggs. At puberty, it's around about 100 million eggs. About 1 million eggs. So as you age, their appetite, they're dying off. So you have a window of about 30 years where there's healthy eggs. But towards the end of that is when eggs become dismature and you have a higher trisomy risk, 21, 13, 18 being the most common. So they have a high risk as you age because of the age of the egg. But if you're ovulating, you're pretty healthy to have that. And we have pushed out the average age of the first baby tremendously. It used to be early 20s. Now it's late 20s, early 30s.
Right. From a guy, as he describes himself, how does weight affect fertility levels?
In a male or female is the question?
Male in this case.
In a male. Well, the problem is fat stores. There's 3 esters in our body, E1, E2, E3. There's also E4. E4 is made of baby liver, fetal liver. E3 is made of placenta. So E2 and 1 what's in our body. But E1 is not a very good estrogen, and it's stored mainly in fat. So when you have a higher EC in a man's state, you become hyperestrogen. That's when men get. Then they get their, we'll call them the soy boy, the men breast, that could happen. So that could throw off their production of testosterone, which would therefore decrease their production of sperm. And this sounds crazy, but different pants that aren't natural cotton, that different natural wool, the synthetic plastic, these microplastics, they have these small particles that rub, and if your underwear is that, you're going to rub your testicles. That's all been proven to decrease sperm count. So it's very important to watch out what clothes you wear. The average American eats a credit card worth of plastic a week.
So basically, from an underwear perspective, go 100% cotton?
100%. No joke. No. It sounds, I mean, it's personal, but it really is. Our skin is a great barrier, but it still can absorb things.
Right.
And when it absorbs things that are detrimental to your effect, that's part of the problem.
Not that I'm looking to be a father again, but I have these pants that are wildly comfortable, but I know they have plastic in them because they stretch and they're great. Anyhow, don't want to get off topic
too,
here.
but I work quarters a day just because I'm on the show and talking about this. I know it's like, can they find a product that have the benefit of both is the question.
Right.
And again, that has to do with, with research and development.
But on the flip side too, if you're a male, you obviously don't want to be heavy, and you obviously want to try to eat as healthy as possible.
But I want to go over that, Jim, real quick. On most males, they're fighting a different fight than 3 generations ago. When the average American male was between 900 and 1,400. That was a study done in the 1940s on Army recruits. So the average male, 1835, was between 900 and 1,400. And we know testosterone burns the right fat. We know it. It builds muscle, changes body position. Now you have today's young boys averaging 250, 300. They're going to battle with 300% less. It's harder. And then they get this thing is like, I'm not working hard enough. I'm lazy. I'm all that. And that's not always it. They're really in a fight with their hands tied behind their back. That's why optimized testosterone is crucial for overall health.
From a female, if I'm trying to get pregnant, how would you recommend I change my diet? I was told, you're going to love this, to try going vegan.
That's the worst thing to do. Okay, the baby's brain is made out of fat and protein and animal source fat. This, other than ethical is if you find ethical, you can find some substitutes. But there's nothing better than free-range beef, fresh fish out there. You want a high fat. Think about it. Breast milk is 56% omega-3 fatty acids. Your brain, the baby's brain, our brain, is 75% cholesterol. The myelin sheath is all cholesterol. So the answer is you want as much protein and fat as possible and a lot of healthy complex carbohydrates. And that in a woman is different than a man. You want to have as many complex carbohydrates. So there's a thing called the Randall cycle we talked about before in a non-pregnant state. You want to no more than 30% of your diet is in fat. So high fat, high protein with the right complex carbohydrates. And again, I would recommend fish oil supplement, probiotic supplement, a prenatal vitamin, and a vitamin D, and an iodine, without a doubt. My daughter, that's what I'd have on all my kids.
Mm-hmm. We may have missed this before, so while we're on that subject of supplements and everything else, I know in the old days, maybe they still do it now, pregnant woman would go see the OBGYN and they pop them on folic acid, saying it's great for the baby, et cetera, et cetera. I know we talked a little bit about this before, but some people may have missed it. Can you
want to methylate? Say, 44% of Americans have this genetic defect called MTHFR, which converts vitamin B9 and it methylates it. And that's important. These vitamins have to be methylated to be absorbed into the system. A methylation means it's adding these 4 atoms, 1 carbon and 3 hydrogen. So it has to be added to do that. Now, the synthetic vitamin B9 cannot have that done in 56% of Americans. So the key is folic acid is very important for brain development, spine development. There's people who have a neural tube defect or anecephalic babies with no brains or have whole spina bifida. That's a defect of that. So it's probably cleft palate as well. So it's very important to have the right folic acid. So if you buy a methylated vitamin B12, vitamin B9, all your vitamins Bs are methylated. You don't have to worry if you are or not. So a methylated prenatal vitamin is the best.
So if somebody gets a bottle of orange juice, for example, it says folic acid in there.
First off, orange juice is poison.
Well, I know that, but I'm just saying that with the folic acid in there, that's not going to do the trick.
So may make it worse too because you're not absorbing it. That makes it worse, especially in young boys. Boys are the worst. They become very hyperactive if they can't synthesize that Bs.
Okay, so back to it's folate, not folic acid. Mm-hmm. That's what you want. What are the side effects of fertility drugs on hormones? Can they have long-term consequences?
There's no study to show in long-term. They've looked at ovarian cancer. They've looked at other things. No, that's a stage. It's a season in the woman's life to try to ovulate. Obviously, there's some hyperphysiological states in that state, but they're trying to overcome some disease processes. But there's no data that I've read that shows that increases ovarian cancer or breast cancer, uterine cancer. I have seen data that says progesterone, not progestins, not progesterone, have increased breast cancer between 30 and 69%, depending on which one it is. So some birth control pills and IUDs, I think as late as 2018, the American Board has shown that progestins increase breast cancer.
If you are on birth control, let's say the pill, the old-fashioned pill, and you get pregnant, is that dangerous or is that okay?
And it's not recommended when you're pregnant to take it.
I'm just saying you make a mistake, you don't take it for a couple of days.
Again, in theory, it may increase miscarriage, or in theory, it may masculinize the baby, but there's been nothing to show that. I've had a lot of patients that I've delivered my time, they were on the pill. But if you miss a pill, nothing's 100%. If you miss 1 or 2 days, you have a chance of being pregnant. Mm-hmm. Okay. And remember, the thing important, the pill has no estrogen in it. The pill has no progesterone in it. They have synthetic estrogens. In America, only one is used called ethylene estradiol. If you look up the molecular structure of ethylene estradiol versus estrogen, a non-scientist can see the difference. I mean, the sidearm is tremendously different. And the same thing with progestins. So they are different structures. The problem with that, Jim, is a progestin acts on the body as the symptoms of it are like women who have no progesterone. It makes them more depressed, decreased libido, moody. That's part of the problem is you're blocking the GABA receptor in the brain because the key fits in the lock but doesn't turn the process. That's why it's so important to understand that a molecule matters. Like example I use a lot is sickle cell. A regular red blood cell looks like a Frisbee and fantastic. It's 2 covalently bonded huge molecules that bond together. In the beta, the 6th spot, one amino acid change and it changes from this shape to a sickle. Just by change, it's very important because these called van der Waals forces, the electrical forces, Everything's in position properly done. If it's not, the three-dimensional shape changes. When the three-dimensional shape changes, it changes how you utilize it, how you metabolize it, how you eliminate it. I think our body knows what structure it needs.
Can low sperm count be treated or improved?
Now, I'm not a pro at this, but there's ways they could take some immature sperm and mature it in the sense of the urologist does. It's very painful. They stick a needle and draw it out. But the overall thing is you want your natural body to mature sperm. Example, why are testicles outside of our body and ovaries are inside? Sperm matures at 96 degrees, okay? 98.6. So that's why the testicles are down at the egg, because they both start in the baby at the same place, and they come down this canal into that area. So back to what we talked about underwear. It's been shown guys with tight underwear have less sperm count than if they wear boxers. So some things like that make sense, but is there ways to mature sperm? You have to be able to produce it. So if you get a man today with azoospermia, he's not producing. You can't make him produce it.
Okay. What are your thoughts on foods we're told to avoid while pregnant? Sushi, can of tuna, sandwiches, etc.
I'm torn on that because it's a good protein source, right? Now I'm going to make people crazy here, but I'm going to say it. The deli meat, it's not the meat per se, it's the nitrites, the preservatives, right? The canned fish, it's the amount of mercury in the can in the tuna. Mercury's bad. But the amount of mercury in a brand new baby's hepatitis B vaccine is 125 milligrams. It's insanity. And the aluminum is too. So I just want people to use common sense. Anything fresh, organic is superior. But if your only protein source is deli meat, I'm eating deli meat with nitrites. But why are the nitrites in the first place? It's preservatives. So these things add up. But I'm a huge believer in non-pasteurized milk. I think pasteurization denatures the proteins. But I understand the American College. I'm board certified OBGYN. And I think we have to ask some of these questions we have to ask some questions, bottom line.
Yeah. Was the raw fish thing more about infection or
no,
bacteria?
It's farm fish is the worst because like sushi, it's a high parasite content of it.
Okay.
But the farm is the worst type of fish. In fact, some of the salmon there, they paint the red on to make it look red. You know, so a free range.
Yeah, think about sushi. You don't know if it's wild caught.
Oh
or
my
it's
gosh,
farm
there was a
fish.
study done in New York City at fish, and I forgot I know it was in the 90 percentile. If they call it tilapia, genetically it wasn't. Like 97% of the fish you say you think you're eating, it wasn't that.
Right.
And the problem is a lot of fish has been GMO'd and then released into the wild, and that's the problem as well. And again, here's the concept: let's make more fish. I think they're trying to help out, but there's consequences to this kind of stuff.
Yeah, because they still think fish is better than a nice piece of beef, right?
Okay, a cow eats grass. We eat the cow. I mean, a chicken eats bugs in the ground. We eat the chicken and chicken eggs. Yes.
At what stage in the fertility journey do you recommend women get tested or support for fertility health?
By strict definition, it's 1 year of trying with a regular period. Me personally, I did 6 months if they're over 30. And then the steps I talked about last episode, the 5 steps, I did them in 1 month. I didn't do that. Well, the one I did the last was laparoscopy. I tried to avoid surgery. The other tests can be done very quickly, and they're outpatient. So just to get some knowledge involved there.
Okay. Alcohol and fertility.
Poison. It's just poison. It's just I'm
But
not
there's
here.
been some alcohol situations where people have gotten pregnant after a nice night out of partying.
But
right?
in the old days, no joking, in the 50s, 60s, and the 40, 50, and 60s, the drug to stop preterm labor is IV ethanol. It actually works the superactive nuclei in the back of the brain to slow down production of oxytocin. So, I mean, there is a place, but you have fetal alcohol syndrome. Alcohol is just not health, is period. And a baby that's
But can it make you less fertile?
Again, it affects every cell, so I'm not saying it won't be positive, but it's
Right.
just
It's not going to help you.
right. The problem is it wipes out the liver. And you think about a baby is rapidly developing at rates you can't even, from one cell to trillions of cells, right? You don't need that on top of that toxicity. You worry about a can of tuna, but you'll pound some tequila.
So that's an interesting question too, because obviously the placenta is a nice barrier, right?
No, it's a filter, not a barrier.
Okay, filter. But I remember like my mom drank and I think smoked. Now maybe because I'm bald now.
My mom did too. Look what happened to me. I don't know.
So, but now today, obviously, it seems like a lot of the moms are very conscious of what they're putting in their body when they're pregnant.
Well, I'm gonna go over the pregnancy and that. There was a famous commercial, Chesterfield, the #1 cigarette recommended by obstetricians. Okay, let's remember who did the marketing.
So when you
okay?
say it's a filter, go into a little more detail.
So it keeps, okay, first off is that human being is not the mother. I'm not here to argue, debate. It is a different genetic entity.
Mhm.
It's one cell thick called Nudibix layer that keeps the placenta away from the mother's uterus. So the uterus is mommy, the placenta is the baby. And you have this one layer called the Nudibix layer. It's literally like saran wrap that keeps that adhered but not too high. So its filtering is nutrition through blood,
Okay.
oxygen and CO2 away. But chemicals sometimes get through. The study I looked at these estrogen mimickers, they did a study looking at 200 most common. They all got through.
Yeah.
So it's whatever you eat, the baby gets. The bottom line. Okay. So it looks like a big piece of liver is what it looks like. It's phenomenally growing. It's a great job, but to say it's going to keep out bad things.
Yeah. So it's not this.
No, it's mommy's immune system that's keeping out the bad things. There's 5 types of antibodies. There's the IgA is the big one there, and that's protecting the baby from. That's why breastfeeding the first 6 months is tremendously beneficial to the baby, till the baby's immune system's maturing.
Since you mentioned tobacco with Chesterfield, does smoking or tobacco usage affect male fertility?
There's studies that show so, yes. A little bit of nicotine, actually, we have nicotine receptors, is actually beneficial. Too much will kill you. But the problem is the inhaling part, right? And then you've had nicotine sitting there for a long time. You get leukoplakia, it leads to cancer. Everything, I want to say everything in moderation, but we know some things just affect the way cells divide. And when that happens, that leads to metaplasia and dysplasia and then cancer.
And how do those nicotine patches work?
They're giving you a little bit, a small amount, and a little bit of time to your brain, because smoking is a physiological and a psychological addiction. It's not both. I mean, it's not just one. So trying to weed off that is that way to go. But most studies show cold turkey is the one you really is the best way to go. But when you inhale, like vape, whatever, when you inhale something, you have such a higher volume and the heat. That's a big balloon in there with a very thin membrane. You want to keep as many toxins away as possible.
Yeah. Does stress impact fertility?
Yes. Back to the brain again. The hypothalamus antipituitary. These FSH and LH are called gonadotropins. They release, again, a certain frequency and amplitude. The number one reason to throw those off is emotional stress. That's why a lot of young girls in school, exam time, pressure time, is when they throw their cycle off. We see a lot of, they say, world-class athletes miss their periods because they're working out so much. We heard Dr. Uberman, I forgot the lady's name from Stanford, says, no, her best world-class athletes keep their periods. They keep their periods. So again, a woman in that age that's cycling is actually saying her body is working darn good. It's a very complex situation that's working.
And on the stress thing too, if you have a couple that, is anxious to get pregnant and they're not, and it's month 1, month 2, month 3.
I've been there.
Stressors are going up. So it's counterproductive to them at that point.
Right. Me personally, when I did it, I did a general fertility, not the IVF stuff. I didn't make them keep their temperature. I didn't make them keep a data.
Right.
I just said, I used to just draw this 28 days. The middle, I put a smiley face. I go enjoy life. Because 20% per month, just go enjoy life. And if you didn't hit it in a certain time, then we check the tests.
Right.
But when you put stress on, it becomes mechanical. It takes you from the gift of intimacy. All this stuff goes away. You don't want it that way. But I understand the emotional part of it. I've been there.
Yeah.
And so the key is, and then the hardest part again is, now you're pregnant. My wife and I, we had a couple miscarriages. We understand that. You just have to, again, enjoy life when it comes.
Yeah, when you do have miscarriages, it seems like a lot of people maybe have 1 or 2, and then they have 4 kids after that. So
about
when do you find that can be a concern?
Well, about 50% of women have miscarriages in their lifetime. It's getting higher all the time. So here's the strict definition. Dr. Davajan wrote the book on it, and he trained me. And his wife never had any babies. They became infertility specialists, by the way. It's a little side note. But strict definition is 3 in a row in the first trimester. I did after 2 in a row because all is a blood test. And the most common reason is I don't know. The next common reason is it's called antiphospholipid syndrome. It's where your body's making these small blood clots that clog the filter. And the treatment's a baby aspirin, okay? Or something called Lovenox. So there are ways to get through it. That's number 3 reason. Number 2 reason is the chromosomal abnormalities. So I believe 1 and 2 are probably the same. We just don't mix them. If you don't have exactly 23 chromosomes each side line up perfectly, it's going to be a miscarriage. What about Down syndrome? Yes, but even most babies that are Down syndrome don't make it.
Yeah.
Yeah,
because we were trying to start a family, and my wife had 2 in a row.
Yep.
And then we did the chromosome testing and everything else, and thankfully that was all good. And then 4 kids later,
Right.
you know,
And
everybody's
I mean,
happy.
it happens. It's just the thing about it is, again, this is where maybe I have a belief, but life's precious. It's just precious. And that's why I take it very hard. If a society cannot take care of the most dependent, the baby, the old person, the sick person, the Down syndrome, we're not a society. I don't believe in the idea of the word the greater good. The greater good doesn't look at Jim. It looks at the whole society. What's best? Well, Jim's got to go make society better. No, society's at its best when everybody is looked at as an individual. When everybody's an individual, society is at best. And that's why I think we judge a society by the way you take care of others who need you.
I think you've already answered this question too with your comment about athletes in regular periods. Can excessive exercise impact fertility?
100%. It can make you amenorrheic. But again, if you're eating, the problem is you're usually not eating enough food.
So wait a second. It makes you what?
No periods.
Okay.
So again, remember, a period is only a sign of ovulation. So if you're working out hard enough, or working out hard, we're talking world-class athletes, and you're having a period, or even a normal one, start to work out, then you don't have enough fat. You need you need cholesterol to make this stuff. You need fat in your body. So therefore, it's important to understand that your nutrition's great. I wish I remember the doctor's name from Stanford, but her study on young women was fantastic. So you got to make sure they eat, and they can't restrict carbohydrates. Again, that carbohydrate on a woman is different than a man. Progesterone, which is the hormone you need after you ovulate, loves carbohydrates. So when your body's craving it, you give it.
So could one argue if somebody's working out too hard, they're not having periods, they should maybe slow down the workouts
100%.
and also look at their diet?
100%. Because then the problem is your adrenals can adapt pretty well. Adrenal deficiency happens when you are throwing that off. So if you're having no periods, your adrenals stink too. So you got to get that checked. But the adrenals will adapt and get back to normal if your other things are working. So, but there's sometimes you have to actually give the adrenals a rest and give them adaptogens and things like that. We test at our place. If you're not improving, it's a saliva test to find a curve. You find out where you fall in that curve.
Is there a fertility window for men like there is for women?
It should not be. You do not lose sperm or testosterone with age. A man loses with age because his exposure to these toxins, not because of his age. In fact, we were talking about the other day, we've done 80,000, 100,000 placements. I want to go back and dig that data to show, because I could tell a 25-year-old boy walks in or a 50-year-old man walks in, I can already tell a 50-year-old man is going to have higher testosterone. The books say it's the opposite, but I know that after doing thousands of these because he was not exposed in the womb like this other younger generation.
We talked about this before with the females being on BHRT and getting pregnant. You treat a lot of military guys in their 20s. They're on testosterone and their wife gets pregnant.
Yep.
Is that a problem can the man continue with his
Very good.
testosterone, or should he come off?
Well, Baylor did a great study on this in 2007 and looked at this because most wives don't want their husbands off of it because they know how they feel off of it. So they looked at the protocols. There's basically one go off of it, but can you stay on it? And the answer is yes. So what you want to do is you want to mimic the cycle. So first off is the study was done on cyprinate, the shot, not pellet. But within 10 weeks of being treated, 40% of men had no sperm in 10 weeks, called azoospermia. I mean, 60% do, because it's not a contraception. Now, of those who do have low sperm and want to stay on testosterone, there's 2 protocols. You can give LH, okay, which makes you ovulate, and a woman makes a woman ovulate, and a man makes sperm. But you can't give LH, but you can give one that looks just like it, called HCG. There's an alpha and a beta component in that. Again, the alphas are identical. The beta is really, really close. If I shoot it into a woman, she can make her ovulate. A man can give you sperm. The problem is it gets very expensive. It used to be cheap. Now it's more expensive. So that's one way to do it. That comes from baby's placentas, where it comes from. Another one is to block the brain's receptor of the estrogen. Because remember, estrogen controls the production of testosterone by controlling those gonadotropins. So if you block it with a thing called Clomid, it will trick the body to make more FSH, LH. So that has a 70% pregnancy rate. Now, for those who can't have that, then the option is take them off of that and then see if they are the 3 to 7 to 10% of men who never had sperm. There's not one paper since 1937 that has a sperm before you're treated, treat, and then the future, which is interesting. Because but again, we know today's population, 3 to 10% don't have sperm at all.
So basically at Optimal Bio, you do have some patients that are on treatment, BHRT,
They got their wives pregnant without trying, and guys, and our protocols, yes.
Right, yes. Okay.
But if you don't, then I recommend you take it off between 6 and 18 months. You'll get back to where you were. And if you never go back up, you were not the one.
Got it.
Okay. And there's ways to treat with those gonadotropins called FSH. There's ways to trick the body. That you go to a urologist who specializes in that.
35-year-old man, I'm taking zinc and magnesium every day. Will this impact my fertility, or are all supplements safe?
Okay, they'll all be a very strong word to say, but zinc and magnesium are very important for sperm production and testosterone production. So those are great.
Okay. Are there any natural methods for boosting male fertility other than what we talked about, keeping the testicles cooler, cotton, blah, blah, blah?
Well, to increase your testosterone naturally. Fasting has been shown to increase 1,300%. Eat deadlifts, squats, the biggest muscles you have to push them, that will increase it. But you're talking 30, 50 points, nothing huge.
Quick question. Does your sperm count go up and down during the day like your testosterone does?
Well, we make sperm 15 minutes, so it should not per se, but the actual fuel does change every day from higher in the morning to lower at night.
All right.
So we're talking very minuscule amounts.
Okay. Is ashwagandha safe once you are pregnant?
There's no studies on that per se, but it's very important for the adrenals and for relaxation. I'd say at this time it probably is, but I would not. I would take it off if I was an obese still.
And what about this?
You have the power.
One last question.
You have the power.
One last question. Pregnant woman, heat, hot yoga, saunas, things like that. Bad, good, stay away.
There's some during the LA Olympics. One of my professors did some studies on world-class Olympic athletes who are pregnant. So the heat went up, and they found they had smaller babies and easier deliveries. So I don't know, Jim. We know sauna is great forever. Heat's good forever. But a brain development is different. So I'm not sure how much it'd be because they avoid, this is very important, Jim, in the first trimester, nothing over 104 degrees because you could actually stop the brain development of a baby. That's why the hot tub saunas are poison the first trimester. Later on, I'm not sure, but I'd say no.
Mm-hmm.
I'd rather err on that and say no.
Okay. Hey, this has been phenomenal. I mean, I love this talk today. Thank you for all of your information, and thank you everybody for joining us today. Clock Talk with Dr. Greg Brennan.
Thank you, guys.